As always, I'm going to have you start by stating your name for me, how you spell it, and your position.
Sure. I'm Dr. John Vanchiere, and I'm a professor of pediatrics at LSU Health Shreveport and director of our community outreach for testing and vaccination program. Last name is spelled Vanchiere.
Perfect. Cool. So I know that we are making some gains in terms of the Johnson & Johnson vaccine. It was just passed for emergency use. So talk to me about what that means in our fight.
Yeah. So this is another big helper, another tool in our toolbox that is very effective at preventing COVID-19 disease, especially severe disease. So it's a big win, and what it's going to allow us to do over the next month is very, very dramatically ramp up our vaccination in the community.
And I know that for Johnson & Johnson specifically, there's kind of a distinction more so that it's more effective versus getting really sick versus not getting it at all. Can you kind of explain that distinction?
Sure. So the data that is available for the worldwide study showed about a 66% effectiveness at preventing disease, which is a good vaccine. And specifically in the United States, that number was 72%. And the reason for the difference is that in some areas of the world, there are variants that have emerged that are not so well covered by the Johnson & Johnson vaccine. But in the United States, currently 72% against all disease. And that when you look at just severe disease, severe critical and those that require hospitalization and may lead to death, the protection level there is at 86%, which is extremely good. And the advantage of the Johnson & Johnson vaccine is that it's a single dose regimen rather than a 2-dose regimen. So that makes it a lot easier to deliver. It also it can be kept in refrigerated temperature, doesn't have to be frozen. And so that also makes it a lot easier for us to transport it, to get it out in the communities and to use it more effectively.
And I want to touch on something that you just mentioned was the effectiveness against the other variants that we're seeing. So how much information do we have on that right now?
Yeah. So the particularly the South African variant is not well covered, or not as well covered by the Johnson & Johnson vaccine. And that's an important factor for us to weigh in our public health measures. As we watch these variants emerge, and we've been watching them for nearly a year now, some are advantageous to the virus and some are not. Most are not advantageous to the virus, but a few of them are, like the South African variant, the UK variant, the Brazil variant. Those give the virus an advantage. So, as we pull tools out of our toolbox to fight the pandemic, the virus is pulling its tricks to try to subvert those measures that we take. And variants are one way that happens. So we're part of a national and international consortiums to monitor variants at our site, and we're looking very closely at as many sequences as we can to look at those. Other vaccines at this point that are available are showing very good effectiveness against the variants that we've talked about.
And so as we continue to have more and more options in terms of getting a COVID-19 vaccine, what would you say to people who, maybe want to take a specific one because of what they've heard and they're comparing them? What would your advice be to people?
Yeah, a few things. Number one, the most important thing right now is to get vaccinated. It doesn't matter which vaccine you get. They're all very effective. They all three of them have, little trade-offs here and there. I mean, it's important to note that the Johnson & Johnson vaccine has fewer side effects than the Pfizer and Moderna vaccines. And so that's going to be attractive for some people. The ability to have require only a single dose is also means that it's a lot easier for us to get it out and it's sort of one and done and then you're ready. So there are pros and cons to each. They're not really designed to be compared head to head. And my strongest advice is get vaccinated. If you're eligible for vaccination per the governor's directives, get vaccinated as soon as possible, because a few things are going to happen over the next month in my prediction. One is that we're going to see a lot more vaccine availability, and we're preparing for that, and so that we can get vaccine out in the community. The importance of that is that the faster we can vaccinate folks, the fewer places that these variants have to go, right? If everybody's vaccinated, variant becomes, non-functional for the virus. So we really want to move the vaccine out into the public as quickly as we can, keeping up with the supply that we have. The second thing, regarding whether to wait for one vaccine or choose one over the other, is that in time, as I said, we're learning more and more about these vaccines. We already know that the effectiveness of the Moderna and Pfizer vaccine is even better than we knew a month ago. And I think the same is likely true with the Johnson & Johnson vaccine. Right now, from a scientific and medical perspective, the push is get vaccinated so that we can prevent these variants from emerging. On the same token, as we see variants emerge, we want to re-emphasize testing. If people are sick with COVID-like symptoms, they should absolutely get tested, because that's our only way to know what are the viruses circulating in our community and be able to detect variants and track them and really become more and more aggressive about vaccination.
Being that there is only one dose that's required for Johnson & Johnson, is it fair to say that it's cheaper to make compared to Pfizer and Moderna, or are you not sure?
So it is actually less expensive to produce the Johnson & Johnson vaccine on a per dose basis. And that's one of the advantages, from a public health and government, finance perspective that it has, in addition to the temperature, questions we've talked about. But yeah, the cost of those Johnson & Johnson doses of vaccine is less than 20% the cost of the Pfizer and Moderna vaccines.
And I know that we've also started to kind of make some more gains in terms of women who are pregnant, who are trying to get the COVID-19 vaccine. Can you speak on that a little bit?
Sure. So pregnancy is in Louisiana now considered a qualifying condition for those who are pregnant that want to get vaccinated. There has been, concern about whether the vaccine may have adverse effects on the babies. And we know, based on limited data, but the data we've seen is that there's no adverse effect on the babes. And we know that that protecting mom in pregnancy is very important. Moms, pregnant women who get COVID illness are more likely to end up in the hospital with severe illness than non-pregnant women of the same age. And so we really want to emphasize, pregnancy, especially for those who have a lot of exposure in the community. If you're a young woman who works in healthcare and you're pregnant, then that's an area where you're going to have a lot of exposure, and it is more strongly recommended that you get vaccine. If you're a stay-at-home mom and can continue to limit your contact with the rest of the community and stuff, then your risk is lower, and that becomes really an individual discussion with your doctor. But the College of Obstetrics and Gynecology and professional organizations, the American Academy of Pediatrics, have strongly recommended pregnant women consider getting vaccinated.
Anything else that you want to add that I might have missed that you think is important?
Well, I think my message is I've tried to be consistent about the germ is still winning the battle here. We're getting more tools in our toolbox, but the germ is still winning the battle. And as we pull out tools that new vaccines, et cetera, the germ's pulling out all these variants and other things. So the battle is still raging and the germ is still winning. And it's, I think, a good 4 to 6 months before we can really be certain that the tide has turned to us winning the battle. But the next 4 to 6 months are really going to show us and are critical to us winning the battle.
And I do actually have one last question for you. For people who have already been infected with COVID-19, what are your recommendations for them in terms of potentially getting the vaccine at some point.
Right. So CDC has said, once a person who's had COVID infection, once they finish their quarantine period, can get vaccinated. What we know is that the vaccine gives a lot higher level of protection and therefore will last longer than natural infection. What I'm recommending, is that if you've had COVID infection, that you wait at least 3 to 4 weeks before you get your vaccine. We've seen several folks, essentially the first dose of vaccine after COVID infection is like a booster. Your immune system's already seen the germ, and then you're going to boost it with your first dose of vaccine. So if you've had COVID, I recommend wait 3-4 weeks to make sure you're back to full health, and then also consider getting the vaccine like on a Thursday or Friday. So if you're not feeling well, if you do have side effects of the vaccine, you've got the weekend to recover.
Well, thank you so much. I really appreciate it. Like I said, thank you for getting up. I know it's kind of early.
Sure. No problem. I got plenty to do.
Well, thank you. And I'll let you know if I have any lingering questions.
Okay, great. Thanks, Tess.
All right. Enjoy the rest of your day.
You too. Bye-bye.